Good afternoon, ladies and gentlemen. Welcome to this new episode of Medcast, your new gateway to the latest medical updates and the rumors we have in the society. Quick weight loss solutions such as dietary supplements, injections, and surgical procedures evoke mixed reactions in the health community. While quick solutions may offer temporary benefits, a comprehensive approach focusing on sustainable lifestyle changes is essential for long-term success. Today, we are so pleased to have Dr. Hussain AlSarraf, who is a clinical dietitian. Welcome, Dr. Ali.
Thank you.
We are so pleased to have you again,
It's my
and
pleasure.
hopefully this episode as well will be beneficial as the other one.
Yeah.
We need to discuss the latest updates we have regarding having a healthy lifestyle, especially with those that people think that this is a very quick way of losing weight. So, what do you have a comment about some people that might think using some medications, using some supplements to give them quicker access to
Yeah.
weight loss?
Sure. Ali, many times, as you said, people do seek many ways in order to lose weight faster.
Yes.
As you know, following a diet that is balanced and healthy will help you to lose weight.
Hmm.
Yet, many people, because they have like a special occasion or they do
Especially if
have,
they have like a wedding or something,
yeah,
they need to lose weight in
or they
2 days.
are going to travel, they want to
Yes.
have a good shape, the summer shape,
Yeah.
before they travel. So many times people, as you said, seek many quick results or fast results solutions.
Hmm.
Now, as we see, many of the common techniques are the injections which people can use
Yeah.
in order to lose weight.
Hmm.
Aside also from bariatric surgeries, so we have many options aside from now following just a plan or a weight loss plan.
Okay, that's great. Now, as an expert in this field
Mhm.
of medicine, let's say,
Yeah.
uh, would you rather recommend using the injections for everyone or just for specific cases?
Sure. So the actual guidelines, it's
Mm.
not just my opinion. It's we always, as you said, in the medical department or sectors,
Hmm.
we do follow the guidelines, the international guidelines. So it's always recommended that at least you try first. I'm not saying with regard to people who now do have the occasion or target in mind in order to lose weight fast. But I'm saying overall, if a person wants to lose weight, he would be thinking for doing one of these procedures or using one of these tools.
Hmm.
But the recommendation is actually to at least try to follow a regular plan in order to lose weight. In case he or she doesn't see results within say 3 months, at
Hmm.
least give yourself some time, because many people actually like try dieting for one say week or 2 weeks. If he doesn't see good results, he said not gonna lose weight,
Yeah.
and then he end up actually eating more and gain more weight.
Yes.
So at least give yourself some period in order to follow diet. If you don't see results, then you can discuss with a physician the possibility of using whether it was injection or
Going
doing
for bariatric
surgery.
surgery.
Yeah, so that would be the proper way.
Now, the point is, before getting into too much details about the injections,
Mhm.
again, as an expert in this field,
Yeah.
how would you describe, let's say, the healthy weight loss?
All right. So always it's recommended not to go for fat diets as we discussed in earlier episode.
Hmm.
So because that will tend to have say negative aspects or side effects.
Hmm.
If you do follow unhealthy weight loss plan, you will end up eventually losing weight. Yet
Hmm.
on the other hand, you will have maybe some health issues.
Complications, let's say, or
Yeah,
issues,
or
yeah.
complications. So if you do follow a really restrictive diet and not eating or having enough nutrients, you might end up having anemia.
Hmm.
Especially we see it with women
Hmm.
because they too tend to have a period on monthly basis.
Hmm.
They do require more iron overall. So if they are already following a very restrictive diet with low iron intake,
Hmm.
they will have higher chance of having anemia. On the long term, they might overall, whether it was men or women, they might end up having osteoporosis
Hmm.
because of low intake of calcium.
Yes.
On the other hand, you might end up losing more muscles
Hmm.
because you are not eating enough amount of protein.
Proteins.
So we do have many drawbacks if you do follow a very restrictive diet.
Mm.
Aside from also feeling fatigue, not having good energy to do maybe even minimal tasks during the day. So these are all negative aspects. it's always recommended to follow a healthy diet overall.
Well, you have mentioned that symptoms, which are very great to remind
Mhm.
the users or the patients on the healthy lifestyle and the
Yeah,
unhealthy way of having a diet.
yeah,
But how about regarding the parameters? Now, if we say
mhm,
some people might believe if they lose like 10 kilos in 1 month, that's
yeah.
a good achievement. Is that a healthy way of losing weight?
So it's actually dependent. If you do have a weight, sorry, an overweight of maybe say 5 kilo,
Mm-hmm,
if your ideal body weight, say for example, is 60 and you are currently 65,
mm-hmm,
you might lose 5 kg in a month, but that would be really through restrictive diet,
mm-hmm.
because the lower your body weight is, the slower the rate is.
Yeah.
Say if a person is weighing 100 kg, likely he will be losing say maybe 2 or 3 kg in 1 week,
Mm-hmm,
because he tend to have a high water retention inside his body, and he will be following say a way lower calorie intake than the usual intake, so he tend to see faster results, at least in the first week or 2 weeks.
mm-hmm.
So in that case he might be losing 10 kg. For him that's normal for the very first month only,
Okay.
but then he will be losing less weight. But for other people, no, the expectation should not be that high.
So that's why anybody is on diet
Mhm.
shouldn't compare himself to anybody who's doing a diet at the same
True,
time with him.
true.
Now, one more important question. I think
Yeah.
you have been asked this question very often.
Mhm.
Is it important to see the number on the scale or to see the shape on yourself?
It's actually both.
Hmm.
So, say if you are planning to lose weight overall, it's good that you monitor your weight, because it gets you for sure motivated.
Hmm.
Once you see, at least you will actually feel the difference. You will see
So
that you
it's
are
sort of
losing.
psychological
Yeah,
somehow.
in one point, and it's proving for you, at least you see the progress,
Hmm.
and also the dietitian or the expert you are following up with, at least he can track your changes or results. With regard to the shape, of course, it's also important, because many times, especially with people who are doing sports,
Hmm.
you might actually going to gain muscles
Yeah,
and at the same time losing fat. When you step up on the scale, you will see that your
the
mind
sum
might
is
be
zero.
changing, yeah, a
Yeah,
little bit. Or as you said, you might be having no change in
yeah,
figures. Yet you will feel that your clothes are loose.
yeah.
You will feel that you are more fit. So it's actually both.
So there's, and you will also feel there's a little bit difference in shape rather than
Yeah,
like having a big belly or something.
true.
If you have a six packs with a weight of 100 kilograms,
Yeah,
it's different than being fat with 100 kilograms.
true.
Let's get back to the GLP-1s, which are the
Yeah.
injections. Is there any drawbacks or any like potential side effect of using them?
When people do start using it, it's likely that some people do have like nausea, or people feel like tired or fatigue for especially the very first week.
Mm-hmm.
Some people also get nauseous, so there is likelihood of vomiting maybe during the first week. Yet, when following these plans, sorry, or using these tools, they need to ensure that they are eating proper nutrition,
Mm-hmm.
because unfortunately, many people with these injections, as you may know, it works on two mechanisms. So usually, it's make people feel more full,
Mm-hmm.
and at the same time, sorry, it slows down the digestion and the absorption.
Yeah.
The digestion, sorry, specifically of food. So people will have less appetite for food. With that, you will be eating very few or less amount of food. So you need to ensure that you are eating the proper amount of food in order to at least maintain the muscles, to have good energy, ensure that you have enough vitamins and minerals. Because many people think that as long as I'm following 1000 calorie diets, I'm still safe.
And
But you
I'm
need
still
to
within
ensure,
my range of
yeah, but you need to ensure that you have a high quality 1000 calorie,
yes.
not just 1000 calories. I can still cover, because many people go for like juices or coffees or chocolates, and ignore actually protein and maybe fruits. And on the other hand, they'll be starting complaining, aside from having maybe, say, for example, ladies will start seeing that they might be losing hair
Mm-hmm.
due to not having enough amount of, say, zinc or other minerals through their diet. Uh, uh, Youth, especially men, will start see that they don't gain or maintain the muscles because
Yes.
they are not having enough amount of protein. So the quality of the diet is really important for them.
Okay, let me emphasize this and have a small addition if you don't mind.
Sure.
There is a recent study regarding the use of the
Mhm.
GLP-1s or the injections, or
Yeah.
let's say the diet injections, that has
Mhm.
proved and showed
Yeah.
that there is a muscle loss while using these kind of injections.
Yeah.
So that's why, as you said, you have to
Mhm.
focus on the kind of calories you are
Yeah.
taking, or
Mhm.
the type of food you are taking,
Yeah.
and make sure they are healthy enough rather
Sure.
than just only focusing on the number of calories.
Yeah.
Now, after speaking about the ways of
Mhm.
the diets we have mentioned, or the ways of the losing weight in a very quick way, how
Yeah.
sustainable are this way?
So I always get asked about this question. Many people say, is it better to go for weight loss injections or surgeries
Hmm.
or follow diet? If you, as we said in the beginning, if you tried already diet and want to go through injections or bypass or sleeve, it's really essential that people change their behavior.
Yes.
Because if you go, say, you start using injections or sleeve or bypass, you will be forced eventually to eat less,
Hmm.
especially say for the first for the 6 month period at the beginning, or even a little bit more. But after that, you if you start to have the
The same
back
mistakes
the
back
same
again.
mistakes or behaviors, bad behaviors specifically, you will start gaining weight again.
Yes.
And unfortunately, I have seen some patients who did actually start, say, for example, at 120 kg prior to the surgery, went down to maybe 70
Hmm.
kg, but then they started going back to the hundreds again.
The point is they don't
Mhm.
believe that the stomach, especially with the gastric sleeve,
Yeah,
they don't believe that the stomach will re-expand again
but it
back to
does.
at least 50%
Yeah,
of the previous volume it has.
yeah,
So that's why when they start to have the same bad
yeah.
habits or the same mistakes, they will regain the
Regain
weight.
the weight. Specifically, people, we do notice that they go for sugar
Yes.
food.
Yes.
They tend to drink more juices, more chocolates, rather than having more filling food. So it's all connected.
Probably because the sugars are the lightest kind of food they would have, and
And
they
fast absorbing
yeah,
and easy to
fast
digest.
absorbing, and they will
Yeah,
not reach the satiety very fast.
yeah.
Dr. Ali, we are so pleased to have you today,
Thank you so much.
and we also hope to see you again here.
Sure.
Thank you so much.
Most welcome.
Our dear viewers, we have reached to the end of our segments today with Dr. Ali Hussain AlSarraf. Hopefully, we can meet you again with another medical professional. Until that time, see you later.